friends, welcome back to another episode. I'm so happy you're here. And in today's lesson, I'm calling it lesson because I'm teaching you something. I'm bringing you information that you can utilize in everyday life, and you can also pass that information to someone that you love. So we're going to call them lessons. In today's lessons, I'm going to be talking about the difference between MIC B12 and also semaglutide. We are utilizing our natural weight loss injections in our clinic. And at the moment I am recording this, which is the first week of March 4th, 2025, we have a promotion going, and the promotion ends March 7th, 2025, where you can get one injection for $45. Since it is a new service, we are bringing it into our clinic, and I did a video talking about why I brought this into the clinic. Since it is a new service, we are celebrating this new treatment, the improvements that patients gonna be experiencing. So I brought this in because we are getting multiple phone calls, people asking if we offer GLP-1, glucagon-like peptide 1, which is Ozempic, semaglutide, Wegovy. So we get quite a few phone calls, and we know that these weight loss injections have multiple side effects. As a functional medicine doctor, my job, my goal, my passion, my purpose is to help people heal their bodies without introducing toxic products or using toxins less. Okay, there are toxins everywhere. We cannot run away from them. But if we have the power, we're in charge, and we have the opportunity, right, to do things that are less toxic, that's exactly what we're gonna do. So I'm promoting non-toxic or toxic less products. And weight loss happens to be a service that many of us would love to utilize, but however, many people are trying weight loss programs and treatments and the starvation diet, all those commercial weight loss products out there that are not working. So I took 3 months last year and researching a product that will be working for our patients, and I brought it in, which is my MIC B12 injections. This injection has over 7 ingredients. I'm always adding things to it. There's B12 injections in it, there's B6, and there's also B1 vitamins in it, plus carnitine, which is designed to help with appetite control, cravings. Okay, but there's like helps with cardiovascular disease as well, helps with cholesterol, and then we have methionine, anisotol, and choline. So I'm gonna go over briefly, just in case you didn't see the previous video, what these products are and how they work in our bodies and how you're gonna see the weight loss. Of course, you have to couple that with exercise and healthy eating like you will do. Like we all need to move our bodies before the weight loss injection. You need to move your bodies, you need to stay hydrated, you need to detox, you need to eat healthy, you need to do all of the things. And if you are not losing the weight, then you can introduce the weight loss injections, the natural weight loss injection, to help move the metabolism, and so that you can start seeing the fat loss decreasing, those numbers dropping. I've been getting quite a few questions. Like, how is this different than semaglutide? First, it's natural, right? It's 100% natural. But how is it different? So I'm going to compare semaglutide versus MIC B12, and you're going to see the huge difference, the advantages, disadvantages. And then on the next video, I'm going to do something different where I'm going to tell you exactly when you should do semaglutide. If you're still interested, like I need, weight loss now, but I don't want to be chained to the product, and I don't want to lose my muscles and so on and so forth, and I don't want to experience the side effects. So in the next video, I'll give you a little strategy that I'm using for my patients that desire to lose 100 pounds, and they don't want to do a zillion MIG B12 injections. We get a little bit from the toxic product, but we also have to detox it out of our body. So I'll do the next video about that. If you're interested, you're on semaglutide, you're like, I want to keep it, okay, but I'm not ready to cross over to do MIG B12. So how can I incorporate the two? I'm going to do a video on that. But first, I need you to ask the following questions. What are the root causes? Okay, What are the root causes? Why am I not losing the weight? What is it that I'm doing in my life right now? My lifestyles, my stress management, my nervous system dysregulation, the food that I'm putting in my body. What is it that I'm doing right now that I'm poorly managed or I need to get a handle of that's preventing me from losing the weight? Which should be the number one thing, the number one question, the number one process that you incorporate or implement or marinate on in order for you to heal your body. Number one, like you cannot heal your body, you cannot eliminate any diseases, any conditions, whether it's cancer, autoimmune, or weight gain, or hormonal imbalance without identifying the root causes. And I see many patients embarking on a journey of doing the most, or spending money on almost all of the things out there, but they are not getting results. Why? Because they don't know what the root causes are. Do you? I don't. Like, if you don't know, how are you supposed to heal your body? So that's the same thing with weight loss. What are the root causes of my weight gain? If you don't know the answers to that, then you're going to try a lot of things. It's going to be very challenging. Now, you will see improvement with the MIG B12. You will, because we are literally feeding your cells. We're injecting those powerful nutrients straight into your cells. So you're going to help them, support them in working for you. However, but when you know the root causes, that process is easier. It's simpler and you spend less money, less energy, and you'll get clarity on what you need to do to heal your body. So the first question is identifying the root causes. Always, always, always. Is it hormonal? So when I say hormone, I'm also talking about your thyroid hormones, your insulin hormones, your sex hormones. Is it toxicity related? Like literally, are you not able to lose that belly because your fat cells are holding on to your toxins? Do you have liver issues? Because weight loss has to involve liver. Fat reduction has a lot to do with the liver. So are you catering to your liver? Is it medications related? Because we have a lot of medications out there that are literally causing weight gain. I know birth control pills can lead to weight gain. Prednisone, like the steroids, not only leads to weight gain, but also lead to insulin resistance, weak bones. There are so many answers. Is it stress related? Cortisol is a hormone. Are you stress eating? Are you not able to handle your stress? Is your job killing you? Is it toxic people? Emotional abuse? There are a lot. And also the last one that people are not considering is a gut infection related. Yes, if you have Coxsackie, cytomegalovirus, parvovirus, Epstein-Barr virus in your gut, these pathogens are producing toxins that are keeping you stuck. They are producing toxins and your body is creating antibodies and you're not seeing the result in your weight loss. Ask yourself that question first. And then the second thing you need to consider is also detoxification. Now you can try to make B12 and then detox, or you can detox and then make B12. I have a perfect program called the Total Body Restoration that helps with detoxification. With the detoxification alone, you lose a few pounds. And then you couple that with make B12, the weight loss is accelerated. Think about these factors first before you do any injections, whether it's the MIC B12 or semaglutide, like literally think about all of it. And now I'm gonna share my screen with you and we're gonna compare the products. So first, because I want to show you how powerful MIC B12 is, this is like a recap of things that we discussed before. It's MIC B12, which is methionine, which is an amino acid that supports fat metabolism and liver detox, and inositol, which is a carboxylic sugar that helps regulate insulin. So again, we're working on the insulin hormone. And then choline, which is specifically for fat accumulation in the liver. And then you have your B12 that boosts your energy, helps with neuropathy, mood, transformation of oxygenation into your body. And then carnitine is not showing up here, but carnitine is for appetite control and mood regulation, cardiovascular related. So how it works is that it enhances fat metabolism. Yeah, we need to break down fat, not muscles, fat. And it prevents fat accumulation. So we're not accumulating fat, and helps with energy and insulin sensitivity. You can see here, and there are studies proving that this product works. They lost weight and they have more energy and they have more muscle preservation. And this also decreases inflammation too. Methionine helps with heavy metal toxicity. Did you know that? That's part of the detoxification in the liver and also reducing inflammation. Obesity is an inflamed metabolic disease. Okay? Like if we're not losing the weight, that means you're inflamed. If we keep gaining weight, that means you're inflamed. If you're not eating and you're still gaining weight and you're not losing weight, that means you're inflamed. We have water weight, we have toxicity weight, we have gut infection related weight, we have hormonal weight. Improve moods and cognitive function. Anesthetic is designed to help you feel good, decreasing your anxiety and depression. There's a study on that. So this product, Mick B12, does a lot to your body that you're not even aware of. And then we have Wegovy here, suppresses your appetite. So the thing about semaglutide or GLP-1, when you use that product, you have to train your mind and your brain to be on Ozempic for the rest of your life, to be on Wegovy for the rest of your life. Like if you look at the description, right? How does it work? How does the GLP-1, semaglutide, Wegovy work for weight loss? How does it work? It suppresses your appetite. But again, we need food. We need food to feed our cells, to feed our brains, to feed our muscles, to feed our organs for them to function. Food is like putting gas in your car. This delayed your stomach emptying. So therefore, you have slow transit time. You're holding on to the food that you ate 2 days ago, making you full. Yes, you are going to lose weight, but you're losing muscle. These 3 points right here is a no-no for me. Like, I don't want to suppress my appetite. I want to have appetite control, craving controls, but I don't want to stop eating. Delayed stomach emptying. Why? I want to process my foods, use those nutrients to penetrate my cells and serve them. Reduces blood sugar levels and insulin resistance. Okay, well, I'll give you that, but this is how it's doing it though. So think about that when you're considering GLP-1. And then, of course, the side effects are all over the place. You can Google whatever injections that you're on. You can see all the side effects. You see nausea is very common. Digestive issues, that's stomach pain, muscle loss. Let's look at a chart that tells us the huge difference between the two. So MIC B12, which is a lipotrophic, meaning lipofat, trophic means burn, is designed to burn while still give you energy. Okay, so what it does, it boosts metabolism, it helps liver detoxification and fat breakdown. That's exactly what we want. With GLP-1, it slows gastric emptying. We don't want that. Reduces appetite and improve insulin resistance. We talked about that. So MIG B12 is best for people that are looking for natural weight loss, natural metabolism, long-term weight loss. For people that are looking for delayed gratification, feeling good in the body for a long time. Versus semaglutide is short-term, rapid weight loss. Like, let me do injection this week and lose 5 pounds of muscle in 3 days. We don't want to do that. And the thing is, I know so many patients that are on semaglutide, they are not losing weight, or they're losing 5 pounds in 6 months, or 15 pounds in a year. Make B12 will boost metabolism, energy production. If you're not energized, you don't have energy, you're not gonna get your tax done, you're not gonna food shopping, you're not gonna cook, you're just gonna pick up something on your way home because you have no energy. Muscle prevention. We make B12, we preserve muscle by supporting liver and protein metabolism. With GLP-1, you're losing muscle. Like you feel weak. If that's all you're doing is injecting yourself with semaglutide, you're doing nothing else, you're not working on your diet, you're not exercising, you don't have the energy to do any of that, and you haven't changed any of your food or your dietary habits, you're losing muscle. Even if you did change your dietary habits, there's so much you need to do to preserve those muscles when you are on GLP-1. Liver and gut health supports liver detoxification and bile flow. GLP-1 stresses out your liver and messed up your gut. That's how we have the nausea, the stomach issues. Sustainability with MIG B12, you can sustain it for a long time. With GLP-1, you will gain the weight. The minute you stop those injections, the weight will come back. The minute you stop those injections, the weight will come back. Now, side effects, there's really none with MIG B12, unless you work with a practitioner who has no idea how to do this, but there should be none. There should really be none because we're giving you vitamins, amino acid, supplements that you can really get from your food and you can take from a pill. It so happens the injection is faster, it's better, it gives you more result, and you see improvement quicker and faster. It works better. With GLP-1, the side effect, if you Google it, it's a laundry list. Nausea, fatigue, dizziness, stomach pain, tiredness, muscle weakness, aggravates your pancreas. Like literally, people end up having pancreatitis and liver issues. Cost, the cost is $150 to $400, but we're only charging $45 until March 7th, 2025. And after that, it is $65. With GLP-1, get ready for insurance to the nine for you to have a hefty copay because the cost 1,000. Now you might be saying, well, Dr. Genty, Amazon has it for $50 or whatever company that you go to. They are compounding it. You might not get the dosage that might work for you in terms of losing muscle, not weight. And it's a volume game for these companies. They have to see so many people. You have to keep coming for at least 6 months to get this. Without insurance, it's $1,000 to $1,300 without insurance. Long-term benefits. Prevent metabolic slowdown, improves energy, cognition, and liver function. I don't want to lose my brain. With GLP-1, semaglutide improves diabetic markers, but again, it's a false result. You're gonna start seeing the side effects of it. But when it comes to make B12, I think it's always a yes. Even if you're doing semaglutide, I think you can literally benefit from it because of the B vitamins, the amino acid, the liver support, the brain support, the hunger support. But you cannot go wrong with make B12. You cannot. Like if you look at the list of advantages, the pros and the cons, make B12 plus will always win. Because we do not want to inject a product that's going to destroy our body. Yes, you're going to feel great looking at yourself in the mirror, like, oh, I'm losing weight. That's great. But guess what? This product is actually slowly causing more issues, side effects, adverse reactions, that's gonna pile up, and then you're gonna wake up one day with all the side effects while you're looking great in the mirror, but not having the energy, losing your muscles, feeling weak. If you guys like this type of content, I would love for you to comment below. If you are interested in taking part of our special natural weight loss injection promotion, you have until March 7th. Even after March 7th, it's still a good price, $65. You can do 10, you can do 6, and you can couple it with other things that you're doing as well, and you're still gonna see the benefits. So reach out to us. We have all our information, the links below, and I can't wait to support you on this weight loss journey. Until then, I see you in the next video. Bye.